On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Karen Cruz, a dedicated physician with a passion for helping individuals maintain their health and independence as they age. Dr. Cruz was born in El Salvador and spent her early years in California before settling in New York, where she was raised. She earned her medical degree from the New York College of Osteopathic Medicine and went on to complete her residency in physical medicine and rehabilitation at the Schwab Rehabilitation Center in Chicago, Illinois, with a diverse background and strong foundation in rehabilitative medicine. Dr. Cruz brings a thoughtful and holistic approach to care, one that supports mobility, functionality, and quality of life for patients at every stage of aging. On today's show, we'll be discussing an important topic, staying active and staying healthy as we age. Dr. Cruz, thank you so much for being on today's program.
Thank you for having me.
So tell me a little bit about physical medicine and rehabilitation.
Yeah, so often it's known as PM&R, physical medicine and rehabilitation. We're called physiatrists. So our specialty focuses on preserving function for patients. So with our patients, we're looking to, we focus on function, looking at them as a whole and how we can keep them active, which is, I kind of stumbled my way into this specialty because I thought of myself, medicine, instead of focusing on small areas of the body, I wanted to kind of focus on quality of life, and that's what physical medicine and rehabilitation does. We're focused on, keeping patients active. It's actually a very broad field, I think, which is why it attracted me to it in the first place. So on the inpatient side, so we have patients who are hospitalized on inpatient rehabilitation units. They're recovering from illnesses, strokes, spinal cord injuries, traumatic brain injuries, deconditioning from long-term hospitalizations. And we work with them on the inpatient units to try to get them independent enough and safe enough to return home.
So you're not treating, if God forbid I had a stroke, you're not treating me for the stroke, you're treating me after I've gotten better from the stroke? I'm not sure I understand
Yes,
that.
exactly. So once they're medically stabilized and cleared to be discharged, then they can move on. In those cases, people recovering, from injuries, strokes and things.
So really after a stroke, after the acute phase, the initial phase, you helped me get back to where I was, or as close as I was before I had the stroke.
Yes, exactly. And the goal of, on the inpatient side, is to get patients safe enough to return home. And then once they return home, then there's the outpatient side of physical medicine and rehabilitation, where we will see those same patients still continuing on their recovery. In addition, we also treat patients with a lot of musculoskeletal complaints. So a lot of times you'll hear it said that, we treat patients for pain, musculoskeletal complaints in a non-operative way.
So let's talk about that in a few minutes, but I want to focus in on that. So strokes, you mentioned traumatic brain injuries. What is that?
So, patient has a motor vehicle accident, they end up having a bleed in their brain or fracture a skull or something, and ends up affecting their ability to function and
so when
process.
you talk about function, are you talking about speaking?
Yes.
Are you talking about walking? Are you talking about feeding myself? Or are you talking about all of it?
All of the above.
All
so
of it.
In some cases, it can affect, speech, swallowing, physical, they can have weakness, they can have impaired ability to ambulate, to take care of themselves on their own at home. So it can be an extreme change for a person who is completely independent going through life, and suddenly they find themselves dependent on somebody else, to get them through their daily activities.
One of the things I think we all have in common is none of us ever want to be dependent on someone else.
Exactly.
I as a pediatrician, we've always said you're once an adult but twice a child. In the beginning of life, you're dependent on your family and your parents, and at the end of life, we're often dependent on others. So your goal is to keep me as independent as possible? Is that what I'm hearing?
Yes, and for where I practice, we're an outpatient mostly in our clinic. So we get a lot of these patients that have now recovered. They're still continuing to make progress, and we're seeing them on an outpatient side, in addition to people who are suffering from pain. Maybe they're debilitated, maybe they've developed weakness, some injury related to a sport or something. So
you're also dealing with sports injuries.
in some cases, yes.
Wow.
Yes.
So I don't know. I'm a Sunday football player or soccer player, and I haven't done anything for 6 months. I decide this weekend I'm going to start being fit, and I go out and hurt myself.
Yes.
And you help me get back to normal.
Yeah, as normal as we can in most cases.
What a wonderful way to be able to treat patients.
Yes.
So do I make an appointment with you directly, or am I referred to you by my primary care doctor? What's the process?
Most times we receive referrals either from primary care physicians, orthopedic surgeons, neurosurgeons, podiatrists. We see, patients from all different injuries and pains.
So as a physiatrist, your primary goal is to help me become independent when I have a problem.
Right.
What can we do to prevent those problems? What can we do to as I said before, keep me mobile as I age? What are the things I can do?
I think the key thing is exercise. The body was made to move, so keeping, we need movement. I always tell my patients, our body needs movement. So, there are certain recommendations for exercise, our aerobic exercise, strengthening, resistance exercises are important. And I think, when we're younger, we don't even think about this. We're 20 years old with our peak muscle mass. We're not considering what happens when we're 80, what happens when we're 50. So I think it's important, to, in the case that, you're active your whole life, continuing that forward. And even if you haven't been active, you've been an inactive person, you can still, start exercising, start strengthening, and preserve, function and independence as we age.
You used two interesting words that kind of triggered an idea. I'm thinking of my own kids when they were little. I couldn't wait till they stopped being so active. And yet, as they got older, they become less active. And as we become adults, we become less active for a whole host of reasons. But active and mobile, is that the same, or in mobility? And then you talk about exercise. So when I think of exercise, I think of going to a gym. Are there things that I can do besides going to a gym to stay mobile?
Yes, not everybody can get to a gym. There's time constraints, there's financial constraints. So even just going for a daily walk can be helpful. Not everybody's fitness level, is up to lifting weights and jumping on a treadmill, so we have to start somewhere. So I always recommend walking for exercise is a good exercise. They recommend about 150 minutes per week of moderate activity per week, or vigorous exercise, 75 minutes per week of vigorous exercise.
I'm sorry, say that again. 150 minutes a week?
Per week, divided,
Per
of course,
week?
yeah.
No, but that's like, what? That's 2.5 hours a week? I always
Right.
thought I have to work out 4 or 5 hours a day. You're saying it's not?
It's not.
So
You
doing
can-
a little bit is okay.
Is okay. And I think as we age, the more important thing is adding strength and resistance exercises, using, weights, resistance bands, using our own body weight to try to maintain the muscle, because as we age, we lose muscle. Starting in even as early as our 30s and 40s, we start losing muscle mass. So, we try to maintain what we have, and in cases where there's been muscle loss, try to restore muscle strength
Well, that's scary. So I didn't start out very muscular to begin with. You're telling me as soon as I hit 30, I was going downhill on my muscles. I didn't start out very high. Is it ever too late to start? Again, I hate to use that word exercise because it's such a scary word for so many of us, but mobility training,
Yes.
would that be a good word?
I don't
to
think,
use
yes,
instead?
that's a good word. And I don't think it's ever really too late. Not everybody has been an active individual their whole lives, and then suddenly they realize they're having difficulty getting up the stairs. They can't carry their groceries in. They're not able to carry their laundry, in and out
And
the
those are the
laundry
things
room.
that a physiatrist deals with.
Yeah, so we'll get a history, and we'll ask what changes have you noticed, or is your walking speed, is it slower? Are you having difficulty with their activities of daily living? Something we focus a lot on, and how our pain or our function impairs that. So we're looking at things like, things that we do every day, get dressed. go up and down steps, bring in the groceries, and just, daily activities.
So when I'm noticing that I'm having trouble doing things like walking up the steps you mentioned, carrying the groceries, you called it the activities of activities of daily living. When I start noticing I'm having more and more problems, I should speak to my doctor about these things?
Yes, I think that would be a good idea, just to make sure that there's no underlying medical condition that could be causing this. Is this just age related, or get to the cause of it as first? So it's always a good idea. And then from there, if this is something that's impeding day-to-day activities, you can't get the things that you used to do before done, in a timely fashion or at all. So then at that point, maybe they may consider maybe something like physical therapy to kind of help increase, their work on things like strength, balance, mobility, flexibility, and for those cases where it's needed. But there's a lot you can do on your own in the event that it's not to that point where you're not able to complete these activities.
Let's talk about that in a few minutes. But I'm really fascinated by what I'm hearing is that these aches and pains that I have and not being able to do the things that I used to be able to do, I shouldn't just accept it and just say, oh, this is what happens when you get old. I should actually check it out and actually talk about it.
Yes.
How embarrassing.
No,
Oh my
not
God.
embarrassing.
I mean, really, I can't. It's hard for people to admit that life is getting harder sometimes as we get older. I don't want to sound like I'm 120 years old, but I don't feel the same way as I did in my 30s or 40s or 50s or even the beginning of my 60s. But you're saying don't accept that.
No.
You're saying
And
do
I
something
think
about it.
you can do a lot. And that's, I think, the wonderful thing, that our muscles respond to these strengthening exercises and, conditioning exercises, and trying to, increase that strength back up. So, a lot of time I do have a lot of patients who are, aging, and they have that same sentiment, like, this is just part of aging. They should just accept this. I'm 60 years old, I'm 70 years old, that's just what it is. And I always try to encourage them to do more. And it doesn't have to be doing 30 minutes of exercise right away, because that might not be easy. You've never done it before. You're not suddenly going to get up every morning and walk 30 minutes. You can incorporate it, through your daily routine. Go for a walk around the block, local park, or for those who aren't leaving their home, even I encourage them to just several times a day walk it within their home. Let's go to the kitchen, walk back to the living room. Don't just stay sedentary. We want to avoid that when we're working and we're younger and we're at an office. Avoid the sedentary lifestyle. The same applies for when we're older.
What about those of us who are just dealing with pain? Again, what I've heard you say is check it out, make sure it's okay.
Yes.
And then should I be talking to my primary care doctor about seeing a physiatrist, or is this something that I can work with my primary care doctor on doing?
Sometimes, as I mentioned, we sometimes receive patients who have already seen their primary care physician. So they've started them on some kind of pain medication, and then they find that the pain hasn't gone away. And then, but it's something to start. Yes, speaking with your primary care physician and having them evaluate you. Sometimes they'll do some imaging, X-rays, MRIs before they come to us. Sometimes we'll see them first, and start them on some medication. So it depends on where they are in the process, but yeah, it's definitely.
So what I'm hearing is that going downhill isn't necessary for all of us. That
It's not.
things can be reversed.
They can.
I'm going to lose some muscle mass as I get older, but
Yes.
if I do something about it, I can reverse it.
Yes.
I might not be as spry as I once was 30 years ago, but I can maybe not completely reverse it, but I don't have to accept it.
You don't.
Wow, that's a kind of a new concept for me. I think that we kind of live in a culture that says if you're young, everything's good, and as you get older, just accept it. And I just love the way you're re-looking at this, saying, no, fight back.
Yes, and and there are some patients that they have mobility issues as we age. Of course, they're having joint pain, so they'll walk with a cane, they'll use a walker. You can still go out and do within your limitations, of course. Still be up and active, even if you're in your house. Sit up, stand up every. Do some exercises. If you're not able to get out of a chair, do them within the chair, use some weights while in the chair. There's a lot you can do at home without having to, go to the gym, go to physical therapy. Some things you can start the ball rolling a little bit.
So we deal with a lot of patients here, and I'm sure you see them, who really don't have the supports at home. They're living by themselves, maybe their significant others are no longer around, maybe their children aren't around. What do you tell people who are living on their own, and what advice do you give them to stay as active as possible to, I don't want to say counteract the effects of aging, but fight back and stay active?
If you don't have, sometimes I have patients, who are older, and I kind of learn from my patients. I haven't gotten to that stage of the game yet, so I can tell them, do this many repetitions, do this, but I haven't lived it myself. But one thing that I think is having a social network. So if it's like a senior center, a lot of them have exercise classes and programs. Patients do yoga, where it's even in a chair. They told me they do chair yoga. So it's not necessary that you have to be intimidated by the idea of, joining a group and they're outrunning you, and you take it at your own pace. But there's a lot of options available, and some of them kind of build a community on your own.
I'm not sure I understand how you do that. If I'm all by myself, I don't have the supports around me, I don't have the family around me, I'm home, how do I get out to meet other people? Are there concrete things that you can say, hey, this is something that might help? Obviously, not everything works for everybody, but are there some concrete steps?
I guess like I mentioned, the senior center, when you're younger, other different activities, group recreational activity where you can meet friends, meet acquaintances, and interact, because that social aspect is very important. I think it also helps to motivate you to want to come back. If you feel supported, you're going to come back and do these exercises. You can ask your doctor if there's any, if they have any information on any programs that they're aware of. Local centers, religious centers sometimes have information. There's sources out there. I think it takes a little bit of work of getting out there a little bit.
So things exist.
Things
you just
exist.
have to find them.
Yes.
I was just thinking about how during the pandemic, I remember my kids were in their house, in our house, going to school. Everything was virtual, and I remember them showing me they had gym classes, and I kept saying, "How do you do virtual gym?" And they were doing it.
Yes.
I mean, it was jumping jacks, it was stretches.
Yes.
Can you talk about the role of social media? Is that helpful for our older population? I hate to say elderly, because I won't use that word.
Yes.
I'm talking about me. Are there things like that people can check out?
Yes. If you go on the internet and social media, there's plenty of videos, to follow, and that you can do in your own home, so you don't even have to leave your home, just to get yourself started and feeling comfortable. Plenty of exercise videos that I've seen. And you also see people who are older individuals. They kind of can serve as an inspiration, that they've managed to either come back from being weak or injured, and they've made a big change in their lives. So
one of the things I always like to remind myself is it's always more fun to do whatever you're doing it with somebody.
Yes.
Yeah, no question. And it decreases the loneliness, it decreases the anxiety, it decreases depression. Can you talk a little bit about mobility and mental health? Is there a connection?
Yes, I think for sure, mobility, remaining active is good for your mental health. If you're just at home, you can see increases in depression and anxiety. So if you're up, they always say increase endorphins with exercise, and that helps us to feel better about ourselves, our mood. So there's definitely that connection there. So, it's all around wellness, I think. Staying active and mobile, increasing this mobility, I think helps us in so many ways.
So as a physiatrist, you're talking about how I walk, how I move, how I feel.
Yes.
Physically as well as mentally. What about nutrition? Can you talk a little bit about the role of nutrition?
Yes, so nutrition's very important. So, along with the exercise is nutrition, making sure that you're getting enough protein in your diet, healthy, lean proteins, poultry, fish, nuts, legumes, whatever, all different types of making sure you have adequate nutrition. And as we get older, you may need a little increase in protein. Of course, always speak with your doctor to know what levels or grams of protein are recommended for you per day. but that's very important. Also, staying hydrated helps us to stay active.
I always hear that in the summer months, as we get older, we should be drinking more and hydrate more. Is that true? Is that something that we need to take particular attention to? Again, after speaking to your physician, is that something that you think that hydration is so important, more so in the summertime when we're sweating?
I mean, we may lose a little more, fluid throughout the, the day, so it's important to stay hydrated. I still think, same applies, 6 to 8 glasses of water that are recommended within our diet and our beverages, and so.
We started off talking a little bit about strokes, and we talked about traumatic brain injuries and acute problems. And then you started talking about outpatient physical therapy and your patients on the outpatient side. Can you talk a little bit about what kinds of patients need physical therapy and what's physical therapy all about?
Yeah, so physical therapy, a lot of times we get confused with physical therapists ourselves. The name even resembles it. But we work very closely with them. They'll establish a program that's tailored to them for their needs in strengthening mobility, range of motion. So they'll take them through a series of exercises. They'll treat with different modalities such as heat, ultrasound, electric stimulation to try to reduce pain, inflammation. In addition to that, they'll set them up with a home exercise program, and that's something I harp on my patients a lot, is keep up with those home exercises, because the therapists are giving you the tools to then take that with you once you're done with them and beyond.
So let me see if I got this. You're not a physical therapist,
No.
you're a physician. I'm going to see you, you're going to prescribe something and refer me to a physical therapist who's actually going to show me what to do.
Yes.
Wow. So different than, a traditional physician that gives a prescription and says, here, take this 3 times a day. So you're going to tailor my treatment plan and send me to the physical therapist who's going to teach me the tricks of the trade, I guess?
Yes.
Of how to be mobile?
Yes. And they'll, teach you, they'll create a program tailored to that patient, and so it's helpful and more individualized. So.
And then the hard part is I got to follow through.
Then they got to follow through.
So if I'm not really good at following through, can I just keep coming to the hospital every day to do this? How does that work?
We want them to get to the point where they can be independent with the home exercises and that they're doing this on their own. So a lot of it is trying to encourage people, you can do this on your own. Because you're right, we can't have you in therapy year-round, and so at some point, you learn the tools, and then you got to take those tools and move forward. So.
Yeah.
And the other thing, we see a lot of people with pain, but I think what I liked about rehabilitation is we see people of all walks of life. So we see them from very young to old. We see people, one group that I like to work with, and I think when these type of things happen to them, they feel like, oh my gosh, what's going to happen, is people who've had amputations. So we do work with patients who've had amputations, and they're out there, they're living a great life, and once they've learned how to manage the prosthesis, and they can remain active themselves. So there's a lot that can be done, so.
How inspiring that is.
I think so.
I often think of myself, I can be so lazy. It's so much easier to do nothing. And then I see somebody who's had a stroke, who literally has to learn to walk and talk and feed themselves. And I see somebody who lost a limb for whatever reason, and they have to learn how to walk again. And it's too hard for me to get up away from the TV because something hurts. So, is there anything else that you want our viewers to know about staying healthy, staying mobile, and fighting back against the natural aging process?
I think I'd like to just let the viewers know that that we have a lot of control of the outcome. We're going to age anyways, so we might as well age with strength, with mobility. Because if we sit back and we don't do these things, we might lose that independence. We are not going to be able to join in on social events because we're going to be in too much pain, because we're going to be too weak.
I love that, age with strength and mobility. That should be like a bumper sticker on my car. That's a fabulous philosophy, age with strength and mobility. Wow, I really like that. That's a great mantra.
Yeah.
And it's never too late to start.
No, it's not.
So speak to your primary care doctor, make sure he or she is okay with an exercise regimen, and ask for referral to your friendly physiatrist.
Yes.
And is PM&R, physical medicine rehab, a common specialty? I mean, are there people that are only in hospitals? Are there people in private practice? How do you access somebody in your specialty? Is it easy?
I think, there's a lot of subspecialties within PM&R, so you may see them as pain management physicians, so the more intervention that can be done. There's pediatric rehabilitation focusing on children, a lot of times with illnesses like cerebral palsy. There's, like I mentioned, there's the spinal cord traumatic brain injury specialist. So they're out there in different private clinics in all areas. So it's just a matter of depending on the situation and what you need treated. But they're out there, yes. And you speak with your primary care physician; they can help you find the right location for you.
Great information, and probably a pretty well kept secret.
It's a smaller specialty. Yes.
Yeah. Has this been around for a long time, or is this fairly new?
Fairly new. I think it was 1930s, 1940s or so, after the polio.
In the course of medicine, that is pretty new.
Yes.
Yeah. Wonderful way of dealing with all of our patients in that holistic, comprehensive health care. And I just love the idea of aging with strength and mobility.
Tell them that more often.
Thank you so much for what you do. On behalf of all of your patients, thank you. And thank you for being here today.
Thank you for having me.
And that brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, please visit us at www.zormed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals, South Brooklyn Health. Until next time, be safe and stay well.